very good morning to all of you. I hope everyone has come in from their tea break. Yeah? All right. On behalf of Young Lives India, I'm delighted to welcome all of you present here. It's so wonderful to see each one of you joining us in person than on Zoom calls, because you know how COVID era was, where everyone was meeting each other virtually. So it's really pleasure to see you all here. I really thank you for joining us for the Young Lives India's dissemination event, Vulnerabilities and Resilience of Young People, Evidence from Young Lives India. I would now like to welcome our esteemed guests and thank them for taking time from their busy schedule to be part of today's event. I welcome you all. Unfortunately, Mrs. Rekha Sharma could not join us because she had some urgent travel, so she's not present here with us. So I would like to now welcome Ms. Sally Taylor, Minister Councillor Development and Technology, British High Commission. Ms. Taylor has an extensive experience of working in international development and has been at the British High Commission India since March 2022 as the Minister Councillor Development, Climate Change, Science and Technology. Previously, she has also worked in Ghana and Sierra Leone and other previous assignments including working on climate change and nature on international issues. I would also like to welcome Dr. Sudhanshu Bhushan, Professor and Head of the Department of the Higher and Professional Education in the National Institute of Educational Planning and Administration. He specializes in internationalization of higher education, policy issues in higher education, and educational planning. His recent contributions include quality assurance of transnational higher education, Australia and India experiences, public financing, and deregulated fees in Indian higher education and restructuring higher education in India. His present responsibility is to conduct and guide research and to provide policy support to the government. He is the recipient of Amartya Sen Award 2012 for Distinguished Social Scientist, an award instituted by the Indian Council of Social Science Research. He is the managing editor of Indian Economic Journal, and he is also the academic editor of Paripekshya, Hindi Journal of NEPA. Welcome, sir. I thank our chief guests once again for gracing the occasion with their presence. Before we begin, I would just like to quickly show you a short video about Young Lives India and the journey so far.
Young Lives is a collaborative study of the millennial generation. Its design and scale is unique, following the same 12,000 children grown up in 4 countries to identify what can be done to lift children out of poverty. What did we find? Since the beginning of the millennium, Young Lives countries have seen their economies grow. Households are better off and have greater access to services. children can meet their hopes for education. Adolescence is a second window of opportunity, but also a time of great responsibility and risk. Children's economic contributions accelerate during adolescence, even while they strive to remain in school. Gender disparities grow as young people and their families start making choices around intimate relationships, parenthood, and work. Importantly, we found real signs of hope, promise, and policy success. There is important value added in Vietnamese schools, and staying in school protects girls from young marriage. There is also real hope in physical recovery after the earliest years, but to continue to transform lives, access to training, livelihoods, and decent jobs is essential. Young people must be at the heart of inclusive policies to create healthier, more productive, and just societies, and to break the intergenerational transmission of poverty. We're excited to see where they go next. Today we're checking out Galaxy. Licensed
Sorry,
processing
it's just
automation based. Galaxy automates your LinkedIn outreach so you make more
one
valuable
second.
connections faster. Get started with your library of pre-made sequences.
Sorry. Okay. I would just like to give our participants a quick background about the phone surveys that we've undertaken, that was undertaken by Young Lives India. Towards the end of March 2020, India went into a nationwide lockdown in response to COVID-19 pandemic, which lasted for about 75 days. On June 8th, the 2020 Unlock 1 was announced, whereas in July, the Unlock 2.0, and then in August it was an Unlock 3.0. So Young Lives conducted Call 1 between June and July 2020, whereas Call 2 was conducted from August to October 2020. Call 3 was conducted between November and December 2020. Call 4 was conducted between August and September 2020, August 2020 and September 2021. And Call 5 between October and December 2021. We also had the head teachers survey, which was also conducted during this period, and Dr. Singh will be sharing findings from that as well. These 5 telephonic surveys summarize the impact of COVID-19 pandemic on health, seeking behavior, COVID-19 tests and vaccinations, loss of livelihood, education, employment, and mental health of young people in Telangana and Andhra Pradesh. The first telephonic survey was undertaken during the first lockdown, and the last survey was conducted during October and December 2021 with a total sample of 2,719 young people. May I now request our esteemed guests to release the cumulative reports from call 1 to 5, which is present in their folders. Thank you so much. May I now request Ms. Taylor to grace the occasion with her keynote address, please.
Thank you very much. It's a real pleasure to be here. One of the things that perhaps didn't get, wasn't part of the bio, we should have held back a little bit, is this is my second time in India. I did a posting here 20 years ago, and I worked on Andhra Pradesh. And we started the Young Lives research. So it's a real pleasure to be here and to also to come back to India and discover this work is still going, that we're still investing in producing really high quality research and evidence to inform policy making. And so I'm especially interested to hear the findings of this. I've also started my career as a government statistician, so very much involved in analysis and thinking about how we can really sort of monitor what's going on, understand well what is happening. I'm really very glad to be part of this research which the UK has funded, I think, from the beginning, and has really wanted to invest in really understanding the lives of young people and to really be able to provide evidence and to help policymakers make good decisions and to really sort of think about that. So it's a real pleasure to be here. It's very nice to meet Dr. Singh at last, and also to share the platform with Professor Sudarshan. Have I got that wrong? Sudarshan, oh dear, sorry. So what would I say? I mean, I would say, there's lots of, the UK has been really sort of interested in how we sort of create evidence, how we think about and invest in science, in innovation, how we really sort of, and we also work with and support partner governments to make good decisions, to think about their development, to think about where they're going. And so one of the big sort of areas that we really work in is to try and increase that knowledge, that evidence, that analysis. And it's something that internally we also find very important. So one of the things that where we are designing our own programs and our own approaches is very much subject to peer review, to quality assurance on the quality of the evidence, on the quality of the data. How are we deciding what it is that we do? So that's a really big part of the work. And you will perhaps have seen, we issued a new international development strategy this year. Quality assurance it has a number of evidence. It sort of brings out the data. How are we deciding investing in new knowledge and science? That's a really big part of the work. But also in women and girls, which is a big perhaps have part seen of our focus, and something where we sort of renewed our commitment, I guess, to really thinking about how we can improve the lives of girls and women, how we can really help to unleash that potential and that evidence, and to really think about a sort of set of things around that, be that education, be that jobs, be that sort of how to sort of support, including scholarships for, I'm very pleased to say, mathematics as well as science, tech, innovation. And there's a set of things around that where we've really wanted to emphasise the need to really sort of think about how to do that. And as part of the International Day of the Girl Child, one of the things we do is to have a young woman to come and be High Commissioner for the day. I'm hoping one day the British High Commissioner to India will also be a woman. We have yet to break that ceiling, but we're getting there on a number of other high-profile things. But we do lots of work on different types of research, as well as the Young Lives work, which I think is really exemplary in providing this nuanced and detailed picture over time. I'm not sure how many sort of longitudinal studies there are that really follow through and really help to understand what is affecting outcomes, what is really making a difference for children. And the very important issue of who gets left behind and how we might need to think about different approaches and to sort of take that forward. I know there's also been some work done around sort of education and sort of job prospects for adolescents and young people with disabilities, which is another sort of key set of things to think about. And of course COVID has been such a thing for all of us, and that sort of understanding that impact and how that plays out, I'm sure is something that we will be studying and thinking about for a long time, but it's really important to try and get a feel for that and to think about how we can adjust and make changes for things that we do. I think it is, a one in a kind of one of a kind research. I'm not sure we do anything else like that, but we do really appreciate the fact that the Young Lives Initiative has built up this network of different researchers. This overall sort of approach of really investing in that, and also in that connection to policy. And so it's very nice to have Professor here today, and I hope we'll be able to take some of these findings into the work that government is doing, and as it sort of thinks about how it can really use the information that this is collecting, the evidence, the analysis of this, to sort of think about what it is that the Indian government might wish to do to support young women, to support young people more effectively, and to really help us sort of help India grow and thrive. I understand that there have been lots of things. One of my colleagues shared with me, there's been work around thinking about legislation around marriage, and some of the work that's been done in Young Lives on that. So that's really positive, because in the end it is about that research translating into real world change. That's what we're all about. That's what we all want to see. So I'm looking forward to hearing all the evidence and hearing all the findings, and I'll leave it there. Is that all right? Thank you very much.
Thank you so much, Ms. Taylor, for your wonderful insights. May I now request Dr. Renu Singh, Executive Director, Young Lives India, Country Director for Young Lives Longitudinal Study, to share the key findings from the longitudinal as well as phone call survey. Dr. Singh.
Good morning, ladies and gentlemen. It's a real pleasure to have you all with us today and to meet you all after such a long span and actually be able to give some of you a hug. So it's been wonderful to have you here. I'd like to especially thank Ms. Sally Taylor, Minister Councillor, FCD, or British High Commission in India, for joining us. And I didn't know that you were part of the decision making when we started the study in 2002. So it's a real pleasure to have you here with us today. Professor Sudhanshu Bhushan, who's a friend and colleague, and it's a real pleasure to have you with us. And Professor Sudhanshu will, of course, give us critical remarks as a discussant after this presentation. So today, as Saltanat mentioned, we're going to share some of the findings that we collected during the pandemic. Somebody asked me, was it challenging and was it stressful to collect data during the pandemic? And I was saying that actually we were very lucky, because of our longitudinal nature of the study, our respondents are already there. It's a pro-poor sample, because we specially chose a pro-poor sample right in 2001. So we didn't have to start looking at databases and get people who were actually not poor and then say this is the data, which is often what happened to many cross-sectional studies during this period, because you couldn't reach the poorest. We were very lucky, because luckily we'd just done a tracking of our sample in 2019 December, 2020 January. So we had actually just met them in January, and we were planning to do round 6 survey, which was a face-to-face survey in July of 2020. So our preparation was to go into the field in July and do the 6th round of survey. And lo and behold, in March, everything got shut down. So we had to change gears. But because of the longitudinal nature of our study, we were able to just shift tracks, think innovatively, develop we've been using CAPI for many years, but quickly we had to change to the softwares that would allow us to do a telephone survey with our respondents. And the good news is we actually had no attrition. So that, and so of course over the now we are in 21 years since we started the study. um, we've had an attrition in India is the lowest amongst the four countries. India, the attrition is about, I think, 8.2% over these 21 years, which is nothing. And the reason we've been able to do it is because we have supervisors with our research institute in CES and in Sri Padmavati Mahila Vishwavidyalaya in Tirupati, who've remained with us right from the beginning. That's thanks to the funding we got from then DFID, now FCDO, because if they hadn't supported us, we would not have been able to keep this team intact, and we wouldn't have been able to collect this evidence that we're going to share with you today. Why I'm saying this is because it's very important that we understand that it's not just the longitudinal evidence, but it's also in a crisis situation how easy it is to continue doing research, which otherwise you would not be able to. So I'm just setting the pace. So uh, in terms of, just for those of you who are not familiar with the study, we're following 12,000 young people across four countries: Peru, Ethiopia, Vietnam, and India. The first round was in 2002. We began preparations in 2000 when we had to find research partners, sampling, etc., etc. In India, we've been working in Andhra Pradesh, then undivided Andhra Pradesh. And the reason lots of people ask is why Andhra Pradesh? The reason was because DFID at that time was running this poverty reduction programs to a very large measure. And correct me if I'm wrong, Sally, but that was one of the key reasons. And they thought, we would be able to collect evidence, over time because of the work that was also happening parallelly in the state. Of course, by default, now we are in two states instead of one after the division. So we are in Andhra Pradesh and Telangana. And the idea is, we've been, of course, we continue to be in the same sentinel sites. We are in 100 communities. Spread across 7 districts. Now actually those 7 districts have become 13 districts because Telangana and Andhra Pradesh have further bifurcated some of those districts. But we remain in tribal districts like Srikakulam, West Godavari, Kadapa. We also in Hyderabad, Old City, Mehboob Nagar, Kareem Nagar, which have now got further bifurcated. And the idea has been, so over the years, the first 15 years, we were really looking at childhood poverty through the lens of education, nutrition, learning achievements, etc., etc. Yes, and of course, psychosocial well-being, which we've been collecting in every round, along with anthropometric measures, cognitive achievement tests, a lot of household level data, so wealth index, etc., etc., risks that families have gone through, because everything within this, the Bronfenbrenner's framework, we understand that different layers will affect the child. It's not just the child's immediate setting, but even, we found in communities, for example, where a railroad, where a new train came, suddenly there was a change in children being able to reach the nearest city, go to the market, go to a movie hall. I mean, it just goes to the nearest school because there was a train now which could take them easier to a better secondary school, for example. So it can change your entire life. So different layers is what we've been collecting data at the community level. And some very interesting findings I will tell, so those of you who are interested at another point in time, in terms of how even waste disposal at the community level is actually impacting children. And now today is particularly when we're looking at all the climate change and the pollutants, etc., that is around us. I'm looking at this data and saying, oh my God, we really need to mine the data. And for all of you who are interested, all the rounds of data are in the public domain. And we have lots of PhDs and MPhil students in India looking at using our data. And I would urge you all to please go ahead, use our data, write some papers. So what we've been doing is looking at investigating drivers and impacts of childhood poverty, and also understanding transitions of young people now, and what we are calling now young lives at work, because now our cohorts are much older and now they're transitioning into family life and into marriage and relationships, into the labor market. So we're looking at, a different form of transition from the earlier rounds. So this is just a pictorial representation of the younger cohort and the older cohort. When we began the study, the younger cohort were one. And if you look at round six, over here, round six, which was a phone survey, which was supposed to be, which was actually turned into 5 phone surveys instead of that round six. The younger cohort turned 19, and the older cohort were 26. We're just getting ready to go into the field next year in July 2023. Right now, we're just completing the tracking round, because we do tracking between each of the rounds to make sure we know where our young people are. Many of them actually have moved to other states. The girls have got married and moved into new homes. So we have to make sure we know where they are. And because of the relationship over the years, we often ask, some people ask me, how come we've not, the girls, there hasn't been a huge dropout after they've got married. The reason is because we'll ask family members, the parents, to call the in-laws and say that we're going to be calling them to talk to them. So, this is the kind of, so you use your social networks even in research to make sure your attrition remains low. So now the next round that we are going to go into the field next year, the younger cohort are going to be 22 and the older cohort will be 29. So not only can we do an intra-cohort comparison over time as they've grown, but we can also do an inter-cohort comparison. So if you notice, in round 4, the older cohort were 19, and in the phone surveys, the younger cohort turned 19. So we can actually compare the older cohort in 2013-14 with the younger cohort who turned 19 in 2021. 7 years apart, we can see what changes have happened. We've seen lots of changes over time. For example, when Sarv Shiksha Abhiyan came in, this only impacted the younger cohort because this was 2009-10. So we can actually see how enrollments had gone up for this particular cohort, the younger cohort, because of the intervention. So even though we are an observational study, we can actually observe a lot of the policy impacts on these cohorts because it's a pro-poor sample, and because we are looking at the impacts of how policies are actually making a difference to the lives of young people. Keen to understand what's happening to people with disabilities because they remained completely invisible during the pandemic. And we had about 100 people with disabilities in our sample. So we studied them during this period as well. And I'll tell you more about the methodology. So 5 phone surveys, head teacher survey, even the head teacher survey. So, people asked us, we reached out to about 160 odd secondary school principals, both private and government. And how did we do this? Because we'd run a secondary school survey in 2015-16. And we had, it was a very interesting study. We actually looked at 2 waves of cognitive achievement tests of students in grade 9. How are they faring in the beginning of the year and at the end of the year to look at value added? So are they really learning and who's learning more? So we had all this data and we had the principals' contacts, etc. So we just went ahead and did a telephone survey by asking them how schools were responding during this period. Like I also said, we did this educational and occupational trajectories of persons with disabilities in 2020. And we again went back to our sample of young people with disabilities. We had never purposively sampled these young people, but we had within our sample, we had about 100 people who with varying impairments, and we tried to subsample them for the study. Um, of course, we had to, in terms of responding to the pandemic, there were implications in terms of tool adaptations. Piloting was difficult because, we were doing it over the phone. We had to make, one of the biggest challenges was how do you keep your questionnaire short? Because you can't have people on the phone for more than half an hour. In fact, even half an hour was a lot for the young women with babies in their household, looking after children, looking after, caring for older people. So often, even that half an hour questionnaire actually turned into 3 telephone calls. So you could speak for 10 minutes and then you could hear in the background that, we had trained our enumerators that the minute there is a child crying or somebody calling out, please ask them that we will come back to you, and tell us when is a good time to call. The good thing was because there's already a relationship, it was very easy to do that. And that's so often this one survey happened over 5 days because it couldn't happen in one go. So those were the challenges we had to adapt to. We had to have, for the, especially for the disability study, we realized we couldn't just do a telephone survey, especially because there were people with hearing impairment, there were young people with intellectual impairment. So we had to we used a very interesting hybrid model. We hired community guides because we knew people in the community. We already use a lot of community guides during the surveys. So we had these contacts within the communities. We sent them tablets. They were trained to use the tablets and get onto a Zoom call. We had special educators at the other end, along with qualitative researchers, teams that we had set up, who then interviewed them using sign language, adapting, and of course the questionnaires were adapted and simplified for those with intellectual impairment. But these were all done through this hybrid model. So the community guide was there, following safety protocols of distancing, sanitizing. Of course, costs went up during the pandemic for obvious reasons. We couldn't have them travel in public transport, so they had to use 3-wheelers, which were very much more expensive than using a bus, for example. So all those, of course, were all added costs, but we were able to collect data, and we were able to, so for example, how do you adapt timelines, which we use often in asking for stories from during our qualitative interviews. We kind of adapted all those over the telephone and over Zoom. But the Zoom call was an absolute must for us to be able to interact with persons with disability, especially when they were using sign language, etc. So findings from the survey. In terms of COVID-related behavior, and this is both younger cohort and older cohort together, when we asked young people, do you wash hands more often than you used to, almost everybody said yes. So if you can see the difference between call 1 is the lower bar in the lighter purple, and the call 2, so August 2020 vis-a-vis November 2020. Call 2. You can see almost everybody did it. But just look at the last one, working from home. And this is a pro-poor sample. It's so easy for us to say everybody was working from home. But actually, this population wasn't working from home, because many of them were daily wage laborers. Many of them had to go out. They did the kind of work they did, they couldn't work from home. So it's a bit of a misnomer when we say, okay, so it was fine, everybody started working from home. Yeah, but who can work from home is the big question. And did we really, did the policymakers really focus on those who couldn't do anything during this time is the big question. So we asked young people about, what they felt about the virus. One of the young people said, it's like any other virus. We have to be careful about it. We have to wear masks and sanitizers. We get a cough, cold, throat pain, fever. These are some symptoms. So some of them took it lightly and took it in their stride. But others actually got very stressed. And, another young person said, in the beginning, both my elder sister and father got it. Then my elder brother took all of us to get checked. We were told my brother's son, my father, and I were positive. We were terrified. We came to know only after testing. In fact, she goes on to say, I remember her saying, I cried for days because they isolated my father and me outside in a little hut. These were homes which didn't have rooms. You couldn't isolate them into a separate room. So what did you do? You put them outside the house. And those are the lived realities of young people during this period. In terms of access, the good news is 98.9, 99% said we had access to COVID tests. It's not that if we wanted, this is when the tests came in. Yeah, this is call 5. I'm talking of this is 2021, end of 2021, right? In the beginning, there were no tests available. But by the time tests, we're talking of 2021, everybody said yes, and this is across, urban, rural, all caste groups, which is great news. So everybody had access by that time. We had only 8.2% of our sample who said they felt they had the symptoms. So very few actually said, that we actually felt we were positive. And then they got tested. And out of this 8.2, about 59% were positive. Yeah? So out of the ones who did get tested. And of course, you find more amongst this subsample of people who tested. There were more who were positive in urban locations than rural, which is not surprising, which is significant. More males than female, probably because they were stepping out more. And in terms of the vaccination, this is also call 5, which is again by December 2021. We had a total, by that time, we asked them the same question in call 4, which was in August 21, and then in December 21, and the total of 65% by December 21 had actually got vaccinated. So, I think that's also pretty good in terms of across. You can see, of course, the highest welter sires, there were many more, 74% compared to 56. In terms of rural, urban, not significant difference. There was 70% vis-a-vis 64%. Just remember, we have a bigger rural sample. That's why these percentages will look odd. We have a much larger sample of rural young people than urban. And when we ask them the reasons for not being vaccinated, we've got a larger number of men saying, I don't want to get vaccinated because I'm worried about side effects. So 60% vis-a-vis 50% of women. Women's main reasons were because I'm breastfeeding and because I'm pregnant. Those were the main reasons women gave, which of course was specific to them. And of course, almost 14% of the men said, I'm not at enough risk. Women didn't say that. No biases, I'm just reporting. In terms of impact on household incomes, call 2, so this is right after the lockdown, right, in 2020. We had 81.8%, is 82% actually saying that there was a decrease in household income. And again, you can see that, it is significant by location. So 82.8% of rural households vis-a-vis 78.5% of urban households said that there was a decrease in income. Nothing significant across castes. In terms of loss of livelihood, so how many people said at the household level somebody had lost a job? Again, you find in call 5 vis-a-vis call 2, you can see August 2020, it was a total of 40% odd, which said that there was a loss of livelihood. This came down to 19% by December 21. Now this is the good news. So a lot of people who'd lost their livelihoods actually got their work back. So this is the good news over time. And this only a longitudinal study can tell you this, because if you don't go back to the same households, you'll never know. You can do a cross-sectional study and say, oh my God, close to 40% have lost livelihoods, but you can see the change over time. And there is a change, a significant change for across caste groups, and across gender. You can see that there has been, but of course, you can see that there is still about 19% who continue to have loss of livelihood even in December 21. So one of our, Aruna, one of our older cohort, young women said, we had to stay back in the village for 3 months due to the pandemic. My husband was jobless. Earlier he was working in the bank, but he lost his job. He used to help in collecting loans. Even when we came back, that is, came back from the village, we faced difficulty finding a new job. Almost for a month after coming back from the village, we had to suffer without any monthly income. So these are the more better off amongst our sample, who have better jobs. Even they had a problem. Another young person said, for over 3 months we could not go anywhere. We're a family of 5 people. We underwent tough times. Only if we work, our family runs. So we asked the Mistri, that's the contractor, they took a loan of rupees 5,000 and somehow managed to get through the tough period. So lots of young people talked about, and families talked about the response to the economic shocks by relying on whatever savings they had, whether it was about selling off, something they had, gold in the house, or withdrawing whatever, they had saved up. And of course, the second most important coping strategy was taking assistance from family and friends. We could see social networks coming together at this time to support, so my brother-in-law sent us some money. My neighbor's given me some atta or rice. I'm running out of vegetables. So there was a lot of support from social networks, which was great, of people coming together. But so for example, one of our young persons said, we didn't have money to spend and eat. We took loans, we have taken money on interest, we get credit to manage. Then the